Hello, my name is Zarina Patricio, and I'm here to present my evidence-based practice project on medication compliance for clinical trial patients. Clinical trials are the final step in a long process that begins with research in a laboratory. Before any new medication or treatment is used with people in clinical trials, researchers work for many years to understand its outcome. Clinical trials are essential to cancer care, and data about the current state of research in oncology are needed to develop benchmarks and set the stage for improvement. Treatment compliance can be an important factor in the clinical trial results. There is no sufficient method of measuring compliance, and some of the most widely used techniques are inadequate to date. Patient education has been demonstrated to significantly improve compliance with medication across a broad range of conditions and disease severities. Approximately 50% of patients with chronic disease do not obtain optimal clinical benefit from treatment because of poor compliance with medication regimen. Lack of compliance is associated with poor clinical outcomes, increased hospitalizations, lower quality of life, and higher overall healthcare costs. Our goal is to recognize evidence-based, safe, and effective ways to increase patient commitment to the clinical trial treatment program. The objective is to evaluate peer-reviewed literature that gauges the effectiveness of patient education and orientation in preparation for patients in closely following treatment regimen as indicated by the clinical trial. Educating patients about a clinical trial and investigational drug is necessary to enhance patients' commitment to the protocol and benefit to its therapeutic purpose. About 12 peer-reviewed articles were studied to gather results whether ongoing medication can increase patient compliance to the treatment. Picot question that I arrived at. In clinical trial cancer patients, will providing ongoing medication education compared to one-time medication education increase medication compliance and patient outcomes in 2 months? Although the importance of adherence in long-term therapy is widely appreciated for healthcare outcomes and economic reasons, irregular adherence can also have a disagreeable conclusion in clinical trials, confusing the analysis and disruption of accurate estimates of benefits and harms. Barriers to adherence varies from forgetfulness, depression or feeling overwhelmed, wanting to avoid side effects, and falling asleep before taking medication were noted. Literature review resulted from gathering peer-reviewed articles from different sources. The complete list of these evidences will be provided at the end of the presentation. The major results are the following. COPD patients reduced the proportion of critical errors and patient compliance increased. The patient's satisfaction with an inhaler use also improved. Therapeutic target of glycated hemoglobin has increased significantly in the effectiveness of a primary care nurse-delivered educational intervention for type 2 diabetes patients. Another study with type 2 diabetes showed that patients who received educational intervention responded with an increased level of disease knowledge and improved compliance to medication. Oncology patients showed positive response in improving medication adherence. Reinforced counseling method, TB education, and drug reminder via text messaging by trained health workers are found essential in managing adherence to TB medication. Telehealth intervention in type 2 diabetes, hypertension, and dyslipidemia and rheumatoid arthritis manifested that telephonic outreach increased health literacy, thereby such modality supports the understanding that targeted medication adherence is attained by patient teaching. It is significant to note as well that the length and duration of time spent with patients in medication education greatly affects an increase in patients' adherence to medication. The use of adjunctive counseling materials that provide information is in a relevant, relatable, and non-threatening manner is an effective option in tackling misunderstandings about drugs and their adverse reactions. For a successful clinical trial and safe and effective therapy, patients need to understand the treatment regimen, including medication and its administration. The patient must understand what the drug is intended to treat, its adverse reactions, side effects, and drug interactions. Patient must be informed on when and how the oral drug is taken and what to watch out for, including which food or activity to avoid when on such medication. Patients must know what to do if they experience a side effect and are unsure about how to respond, including how to reach the physician, nurse, or another clinician who can provide guidance or going to ER. A clinical trial drug diary is provided by research monitors, and instructions should be provided by research nurse with a thorough explanation on how to fill it out. While longer follow-up times after interventions might be necessary to permit patients to more accurately assess whether their quality of life has improved as a result of increased medication adherence, significant improvement in patient-centered outcomes with 100% medication adherence is the expected result of this evidence-based practice intervention. Medication education is started at the very beginning as soon as the patient is enrolled in the clinical trial. This is where patients ask the most questions regarding the investigational drug. Considering patients' education preference, the nurse provides pamphlets, drugs, information, and other materials that the patient may review at home. When the patient returns to the clinic for cycle 1, day 1 of the clinical trial, the oncologist explains the important information and answers the patient's questions about the drug. This information is reiterated by the nurse because many times the patients are more comfortable asking questions to the nurse rather than the clinician. The RN calls the patient after 1 week to evaluate how the patient is doing and if the patient is following the treatment plan and adhering to the medication. RN allows the patient to explain in detail how she or he is taking the medication. This is the nurse's opportunity to assess the patient understands the regimen. The nurse must recognize that many patients lack the ability to understand healthcare information and what they need to do with that information. Some of the barriers that inhibit the implementation of the intervention in patient education are literacy, language, culture, and physiological obstacles such as anxiety. Assessing and evaluating the learning needs of the patient is essential before planning and implementing an educational plan. The nurse verifies what the patient already knows and does not know and must correct any misinformation. Ensure the patient's individualized needs are addressed as well as identifying his/her learning style. The patients with vision impairment may need access for information such as Braille, audio tape, or enlarged print. Patients who are fearful and anxious about the whole cancer diagnosis and the clinical trial itself may feel their education is overwhelming and not easy to navigate, which is another barrier to education. Patients who receive medication adherence on average exhibit significant improvements in their knowledge of medications, quality of life, physical function, and symptoms. Another outcome impact is the increased knowledge of medications by the clinical trial cancer patient may enhance their tolerability of medications and which could enhance the patient's adherence to the investigational drug. Stakeholders in this project are the individual and organizations who will benefit from the outcome. For this EBP inquiry, the stakeholders who are involved include CRNs, who are giving the patient education, principal investigators and physicians treating the patients, the cancer patients and their family members. There are also research associates and coordinators responsible for entering clinical trial data, medical monitors evaluating the trial, and pharmacists and technicians dispensing drugs. Making sure that the change occurs is very important but challenging step in the EBP process. Patient-related outcomes can be physiologic, psychosocial, or functional, and they can also be process-related, such as increased patient compliance and adherence to medication. As an existing practice, patients are provided with a pill intake diary, and they are instructed on how to mark them properly. It will indicate the correct dose and dates when medication is to be taken. Pharmacy counts drugs and dispenses drugs returned and thereby determines if the patient is compliant with the numbers of oral pills taken. This is the end of the presentation, and the following are my references. Thank you for listening.